Hey family, back again with the fourth part of our 5-part series looking at kids and COVID. This part focuses on a return to school strategy. Buckle up. Let me get myself situated because I know this has been a very controversial topic. People get heated about it, and rightfully so. You have sort of two arms in this fight, right? You've got the folks who want our kids to go back to school for a variety of reasons. I will focus on the positive intentioned folks, not just in terms of driving economy so that people can get back to work, but for the individuals who rightfully see where children need to have in-person instruction, right? If I had my choice between virtual versus in-person instruction, I would love for my daughter to be able to go to school in person. One, because of the academic experience in being there with her teacher, for her to be able to have access to instruction and manipulatives and books and resources and like it's just a traditional educational experience, but also in terms of the socialization. I think it's critical for children to be able to interact with each other, to develop the necessary social skills, to maintain social connectedness, so that they grow up to be healthy, happy, well-balanced adults, right? I think that's critical. And when we really look at the role of the school in terms of creating safe space for children, we recognize that there are some children living in unsafe environments, either because of their physical safety, because of food insecurity, for a variety of reasons. Their home space is not either conducive to learning or threatens their learning and sometimes even their very lives. So it is important. School plays so many critical roles, that it's important that we give strong consideration to our little ones going back to school, but we have to do it in a responsible way, in a way that does not put our children or the school staff at risk. And then on the other end of the spectrum are the parents who are adamantly opposed to sending their little ones back to school because of concerns about COVID transmission, how well the school will be able to create a safe space, and the risk of their little ones being in that small percentage that end up developing very severe COVID-19 symptoms. So I understand it on both sides, but what I want to do is spend a little bit of time talking about what does a return to school strategy look like. And I wish I could take credit for some of these recommendations, but there was a recent, very well written report that I will include the link to in this particular part that explores what needs to happen, why it needs to happen, and how it should happen in terms of our little ones returning to school. It provides excellent metrics that we'll talk about a little bit here today. All right. So let's jump in. The first part of the conversation is looking at other schools, right? Countries across the globe. What have they done to bring their kids back to school? There are countries within Europe, countries within Asia, countries within Latin America who have now returned their children back to school. And there's some schools or some countries who've done it well, and some countries who have missed the mark. I'm not going to get into the countries that have missed the mark. We'll be able to cover some of those metrics as to why a school or a country would miss the mark, and what we need to do here in the U.S. to make sure that that does not happen to us. But I think using examples like South Korea always shows up as an example of what to do. But I want to give credit to a Latin American country, Uruguay. They have done a phenomenal job of creating a safe space for students to return back to school. They were one of the first countries in the Western Hemisphere to bring all of their students back onto campus in June. And they did it in a very strategic, public health appropriate approach. The first thing that they did was made sure that public health measures were in place for the schools to be able to be reopened in the terms of sanitizing, making sure that people wore their masks, knowing that families would be able to implement social distancing. And then they did alternate schooling. They did in-person mixed with virtual. They alternated the teaching modalities. And then on top of that, they did their return to school process in a very graded approach. They first brought the rural tier of their country, their children within their country back to school. And then they brought in their children with potential immunocompromise or higher risk still within that same environment without bringing the full masses in. They also brought in their high school seniors so they'd have the ability to complete their coursework. And then they came into the metropolitan space, bringing the rest of their students onto campus. But again, folks in Uruguay followed public health procedures. They didn't argue and see civil liberties linked to the wearing of masks, and they respected social distancing guidelines. And thus far, they have been successful in having their children return back to school. Should there be an expectation that there will be zero COVID cases when little ones go back to school, even when the best safety measures are put in place? No, that's not realistic. But what is realistic is having systems in place, such as contact tracing and a couple of other metrics that we'll talk about, so that if and when a child or a group of children become COVID-19 positive, that the school can act on it, has the resources to act on it, so that you don't have widespread COVID cases across the schools. All right. So we talk about how the schools across the country have done in terms of COVID. And I can say that Uruguay has done a fantastic job. The other thing that we have to take into consideration are the groups impacted by schools reopening. It isn't just the children. The American Academy of Pediatrics recently released a report talking about the importance of bringing children back to school. But that's in the context, and I will give them the benefit of the doubt, that's in the context of assuming that all of the measures that we need to have in place to protect our children and the staff of the school have been put in place, and that has not necessarily been the case across the country, across the board in this country, right? And so we have to take into consideration, although over 90% of children, particularly those under the age of 10, are either asymptomatic or only mildly symptomatic, we have to take into consideration that a school population isn't simply the children. It's the teachers, it's the administrators, it's the school staff that will also be put at risk if we do not bring our babies back to school in a responsible and public health appropriate way. What we know is that nearly a third of teachers are over the age of 50. And we know that with COVID, the older you are, the higher the likelihood of a severe infection is. What we also know is that over 5 million employees through the school system have a chronic disease that, again, puts them at risk. And when we know that over 40% of Americans are dealing with obesity, again, that puts the adults in the school space at risk. So even though children may not experience COVID-19 as severely as adults, children come into contact with these adults and they shed virus as much as adults. So we have to take our grown-ups into consideration when we start talking about a return to school strategy. So what we also have to think about are what are the metrics that have to be in place in order for us to know that we can safely bring our babies back into school. Okay. And by babies, I mean from like pre-K all the way through college, right? They're all our babies, right? So what are those metrics? Those metrics include a daily average positivity rate of no more than 75 people per 100,000 residents. And for the most part across the country here in the U.S., we've met that metric. As my last check of yesterday, August 12th, the state leading in new cases was Louisiana at 33.4 new cases per 100,000 residents on average. So we've met that mark across the board. There are now 9 states sort of in what we call the red zone, where it's greater than 25 cases per 100,000, but that's much better than where we started. I believe at one point there were around 15 states in that red zone. Now we are at 9 states in the red zone. The red zone, this is reporting out from an organization through Harvard looking at the daily average of new cases per 100,000 residents for each of the states to assess how well we're doing in terms of COVID-19 transmission. So we want to have at least 75 per 100,000 new cases happening, no more than that. The second metric that we want to pay attention to is the percent positive rate of testing for COVID, meaning that what we're aiming for is less than 5% of tests being done for COVID come up positive. Across the country, states vary. There are some states with as high as close to 20% of their tests being positive. Other states are doing a phenomenal job where less than 1% of their tests are coming back positive. So clearly this is going to have to be on a state by state basis. Unlike Uruguay and South Korea, here in the US, our COVID-19 response has been very state dependent. There has not been a national collective in terms of how we address it. And because of that, we see differences in terms of daily average new cases and percent positive rate. So that also means that different states will do different things in terms of reopening schools. If your state has met the 75, no more than 75 new cases per 100,000 residents, and their positivity rate is at 5% or less, you are well on your way to being able to comfortably bring your child back on campus. But once that metric is made, those metrics are achieved, then the questions become what school capacity is there to protect our little ones in terms of the activities that our students participate in and how schools can mitigate the risk. So the next area we have to focus on is risk associated with various categories. We want to look at transportation. We want to look at in-school engagement. We want to look at sort of the other additional resources for school in terms of nutrition programs, after-school activities, clubs, and that sort of thing. All of that we want to take into consideration in terms of how we approach how a school reopens in assessing risk. And as I mentioned before, the article that I read through, I will definitely include the link because it color codes the different school activities and whether or not it is a low, medium, or high risk activity. But I want to summarize it real quick because some of us are visual learners, some of us are auditory, and some of us are a combination of both. So I figured I'll include the link for your reading pleasure, but also talk about it. So let's talk about transportation. Low risk in terms of transportation, getting our children to school and back. The lowest risk is personal transport, right? You bringing your child to school, or if you've created one of these COVID communities and you guys have been around each other throughout the COVID-19 pandemic, then having one of those individuals in your COVID community bringing your child to school is best case scenario if you end up having to bring your child to school. The next best thing is if you can walk, right? So you're out in public, but you're going to have your mask on, you're going to socially distance, being able to get our little ones to school via some form of personal transport via a bike or a pied, by foot. The highest level of risk is putting our children on a bus, right? So a child on a bus with a bunch of other kids, either on public transportation, because let's be honest, some of our children have to ride public transportation to get to their school, or through their school bus. That is your highest risk because you have several children on a bus in a tight space, and we can't guarantee, the bus driver cannot manage and guarantee that children will wear a mask. So that's where that is highest risk, okay? The second area of focus that we have to think about in terms of returning our children to school is the classroom environment. And how well are we going to be able to implement something like social distancing? One of the issues that I know we had when I taught elementary school was overcrowding of classrooms. If that has been a reality for schools prior to COVID, and a lot of it has to do with funding, how are we going to now socially distance our students such that they are 6 feet apart and are in safe space for them to receive their education? There are certainly ways to do it, like using auditoriums, setting up outdoor classrooms, and clearly that's dependent on the weather, right? I grew up in Southern California, and I'm sure most days Tony claimed it doesn't rain in Southern California. They lied, it does. But for the most part, we probably have the capacity to do outdoor classrooms. Tents are another idea for schools to consider. But again, all of this requires funding support, which is what I'll talk about at the end of this return to school strategy. But you want to make sure that you ask the school, how are they handling books? How are they handling manipulatives if your child is little and there are toys and other objects to be used to teach a lesson? I remember when I taught elementary school, we had these little colored teddy bears, red, green, blue, and yellow. And we use those manipulatives to teach children how to add. What does that look like now in a COVID space? What should we expect as parents, and how are we protecting little ones from cross-contaminating these learning tools? The other is the mask mandate, right? We saw a school in Georgia just recently, a crowded hallway, no one was wearing a mask, and then guess what? The school got shut down because at least 9 children were diagnosed with COVID-19, and now they're switching over to a virtual space. And how frustrating and chaotic and disappointing is that for everyone involved when you had one strategy and then you have to pivot because you didn't implement the public health measures necessary to keep our children safe. So the question is, how are they maintaining 6 feet of social distancing within the classroom? And what are they doing in terms of mask wearing? Is there a policy to require the mask? Is there some mask policing? Is there a protocol to help students become more compliant with their mask? What does that look like? And then the third is the collective space, restrooms, cafeteria. What is the strategy there? Are they allowing children to go to the restroom one at a time? Who's monitoring that? How often are they cleaning the restroom? In terms of cafeteria, the risk there is low in the green zone if children are allowed to eat in their classrooms. And I know there are a lot of teachers that are like, oh, Hancock, are you serious right now? Like, I don't want to have to deal with children eating in the classroom. I have worked on policy that now facilitates eating in the classroom. I helped to create the DC Healthy Schools Act, where eating in the classroom was part of that legislation. And although teachers were initially not too pleased about it, I can tell you that at least from the teachers that I know, they became very open to the idea because one, it saved some time in terms of student transition. 2, it helped address hunger and food insecurity for a lot of students who would have otherwise likely missed some of their meals. But the question is, does a classroom have the capacity to be able to do that? That requires additional staffing, as an example, to minimize risk, and being creative in how we allow our children to eat in the classroom. So that's low risk. Medium risk is having sort of this rotating process through the cafeteria, where it may be one grade going into the cafeteria and spreading out. High risk is literally going back to business as usual, where everyone collectively comes back together in the cafeteria in order for little ones to eat. And then you have to think about extracurricular activities, both in the way of sports, clubs, etc. As much as I love football, I used to be a personal trainer for my high school's football team. This is the season where we're going to have to sit it out. When we talk about contact sports, what we have seen throughout the summer is this recurrent risk of even professional athletes acquiring COVID-19 because you're in such close proximity. You increase the risk of transmitting COVID-19. So unfortunately, contact sports are a high risk activity in terms of COVID-19 transmission. Medium risk activity is having our kids out on the field, engaging in non-contact sports. And then of course, low risk is engaging little ones in a social distanced way of engaging in physical activity, where activity is happening in the classroom. A colleague of mine that I love to pieces, Dr. Tony Yancey, God rest her soul. We lost her a little while ago, but she created something called Instant Recess, where little ones at their desk can be engaged in physical activity. One of the things that I'm concerned about, and we'll talk about it in part 5, are the health habits. How do we maintain our children's health habits, either in a virtual classroom or in a real in-person classroom so that little ones are getting the 250 minutes of physical activity they need per week. But that's sort of how we should approach it. And then other extracurricular activities in terms of debate club and all of those things, there's a way to do it and do it virtually. That's how you make it a low risk, a green activity. I think it would be a fantastic idea to create Zoom breakout rooms for your multicultural club, for your drama club. And we just have to be creative, but be resourced and funded in order to make this happen. So those are sort of the categories of risk and how to approach it. The other part of going back to school is the resources, right? We can't send our children back to school unless schools are funded to provide these provisions, right? So making sure that the schools are cleaned every single day, likely even several times a day. That's a question for parents and other caregivers to ask the school. How are you sanitizing each classroom? How are you sanitizing the entire school every day? This is a different level of sanitation. This isn't just a mopping and a dumping of the trash. This is going to require more funding. And how will that take place? How are they going to incorporate social distancing? Who's going to be there to sort of manage that? Are teachers going to have a diversity of roles? And if that is the case, then how is that going to impact instructional time? All of those are questions that need to be asked. And the way that some of those questions get answered is by asking our state government, our local government, our federal government, how do they plan on funding and supporting our schools in order for us to open up? You can't tell schools to just open up and not resource them with what is needed to do it safely. It's easier said than done. It should not be left up to administrators and teachers to have to figure it out. This is an all hands on deck situation where parents, administrators, teachers, school staff, local government officials, state government officials, and federal government officials all work collectively to support the village that is educating our children. All right. So advocate for your kids, but also advocate for your teachers, your administrators, and every single staff member, your bus drivers, because they are all going to be impacted by the decisions that are made in regards to reopening our schools. But those are the recommendations that I give to you guys in terms of the metrics, the numbers 75 per 100,000 in terms of new cases, the percent positive being 5% or less, and making sure that your school has a clear strategy with resources to support it to keep our little ones in that low risk, that green area, to minimize the risk of COVID for our children from pre-K all the way through college. All right. Last part coming up, the health of our children, their physical health, their mental health. How do we protect it and make sure that we enhance it as we go into the fall and winter? All right. Dr. Yola out.